All right, so welcome back to our September meeting of the VCC. Just a couple announcements before we get started. DMAS has launched an updated eligibility redetermination tracking dashboard, and the eligibility determination tracker displays Virginia Medicaid's overall unwinding status. The link to this website is going to be included in the minutes. And the new dashboard will now be updated weekly rather than monthly, and will have detailed information, including information on demographics, regional data, and data by locality. And so I assume Nick will be including a link to that website in our notes. Another announcement is that there is a new website that provides clear strategies to support family caregivers. A coalition of groups, including NASHP, the National Alliance for Caregiving, and the John Hartford Foundation, is proud to announce the launch of supportcaregiving.org, a new site that supports the implementation of the first of its kind national strategy to support family caregivers. The new site shares specific actions from the national strategy that employers, funders, managed care plans, and state officials can take to support family caregivers. The site also features a short animated video that provides an overview of national strategy. Another announcement closer to home is that Nick has been participating in a kinship caregivers task force work group. And during the last meeting, there was a discussion about how caretaker relatives were being denied child-only TANF for the child they were caring for due to high turnover at the local DSS agencies and a lack of knowledge of the program rules. VDSS provided a resource document clarifying the program rules that may be useful to care coordinators, kinship caregivers, or anyone who might be assisting these families. And the document will be provided in our meeting minutes. Also, DARS has received an administrative supplement from the Administration for Community Living in the amount of $411,000 for the Lifespan Respite Voucher Program. The funds are going to be used to provide reimbursements for another 500 caregivers in the Commonwealth over the life of the program, which will bring the total amount of caregivers that can be served to at least 1,500 caregivers by the end of 2026.
Wow.
Also, the VLRVP, or the Virginia Lifespan Respite Voucher Program, has funding placed in the budget to print copies of our VCC Caregiver Resource Guide that is available for free online on the DARS website. Final approval of the draft was given yesterday, and 1,000 copies are going to be printed and shipped directly to Nick. So anyone who's interested in receiving some copies for their own organization to distribute to caregivers, please let Nick know, because I feel like, 1,000 copies, we want to get those in the hands of caregivers. So if, that's something that would apply to your work, please reach out to Nick, and he can send you some. Is there any announcements that anybody else would like to share about upcoming events or any program updates before we move on to some new business?
Hi, Emily. Good morning. I just wanted to let everyone know that the Northern Virginia Dementia Care Consortium is having their 37th Caregiver Conference, and it'll be on Friday the 10th. From 8:30 to 3:30 p.m. We're offering CEUs, and we're going to have wonderful speakers. So in a moment, I'll put the link to it in the chat. But yeah.
Yes, and Nick can definitely include that in our meeting minutes as well, in the notes that go out. Anybody else have any updates about things going on or?
Hi, Emily. Good morning. Hi, Allegra Joppi with the Fairfax Area Agency on Aging. I work with Juliana and Tammy in the Caregiver and Supportive Service Unit. I just wanted to share some other upcoming education programs that we are hosting here in our unit that you are all welcome to come to and share with folks who could utilize the information. We are having a dignified aging session, and it's going to be Friday, September 22nd. So tomorrow from 12 to 1, and this is in Spanish. And so if you have Spanish caregivers or folks who could, utilize that, I will put that in the chat. We also next Friday are going to be doing a program models for loved ones living with dementia. And so we're going to have a panel conversation next Friday, September 29th from 2 to 3 p.m. And we will have different folks come and talk about respite options. How do you care for different options to keep people living at home longer. And so we're going to have a panel conversation with Insight Memory Care, Blossom, Pace, Cherry Blossom, also Raft will be joining us, and our adult day healthcare centers. So we'll have a panel conversation about that. All the programs are being recorded. So if you still can't make it, we will email you the recording a week from the live webinar. So we'll get you that information if you can't make it. We're also doing 2 more dementia-friendly information sessions in October and December this year. Those are live programs. Anyone can access online as well. They are not recorded though. So those, we do encourage people to come to if they're available live. And that's it for now. And I'll put it all in the chat.
Awesome. Thank you so much. Anybody else have any updates or announcements? All right, just a quick reminder, please fill out our survey. I just dropped the link in the chat. As a reminder, this is just a survey that we ask everyone to fill out at each meeting, because again, we really just want this meeting to be for you all and to have information that is interesting and would be helpful. And so this survey not only gives us feedback on the presentations that you guys have been presented with, but also is an opportunity for you all to provide feedback on some future topics that you might want to see us do at later meetings. So please make sure you fill that out so we can make sure that this organization is what you guys want it to be. Some new business, there's going to be a meeting today at 2 p.m. to discuss our VCC subcommittees. This meeting was set up after the committee interest survey was sent out a couple of months ago. And we're hoping that we're going to be adding 2 new subcommittee chairs to the executive committee. So if you want to hang out with me and Nick and Dee a little bit more, please volunteer for those subcommittee chairs. We meet every other month on our off months from these meetings. Also, the VLR VP, so the Virginia Lifespan Respite Voucher Program, now has a page on Easy Access Virginia, which is really exciting. Hopefully it'll be a great way for new members to find out about us. And after the new person coming into the position who runs that Easy Direct is hired, we'll begin working on the VCC homepage on the same site. So hopefully we can get that up and running soon and have a lot more members. So now I'm actually going to turn it over to Jackie to go ahead and introduce our speaker for today.
All right, good morning. I'm a little nervous, but I'm going to do this, and I'm looking forward to it. So for our presentation today, we are very excited to have Dr. Richard Lindsay, former head of geriatrics at UVA, from the Lindsay Institute for Innovation in Caregiving, talk about the impact of loneliness and isolation on caregiver well-being and some general thoughts about the crisis in both adult and youth caregiving. Dr. Lindsay has served on the Commonwealth Council and its earlier model under 10 governors. He now serves on the National Advisory Council of the American Association of Caregiving Youth and has put in place a high school course on caregiving in one of the local high schools. And so we want to, at this moment, thank you so much for being with us today, Dr. Lindsay.
You're muted.
All right, Dr. Lindsay, I think you're on mute potentially.
Hang on a moment. Oh, I hit the button.
I think you can request to unmute, Nick.
Yeah, I did.
Oh, you did?
I did, yeah.
Should I call him real quick?
Are you able to unmute him?
I can't make him unmute, but I can just
How about that? Can you hear me now?
There, perfect. All right, yay.
There we
All right.
go. All right, well, that's half the battle right there. I apologize for missing our last meeting. Can you, everybody can see the pictures yet?
Yes.
Well, I apologize for missing our last meeting. I had a little GI problem. I was unable to be there. So I was going to thank you for letting me have the privilege of coming back and saying a few words to you. I talk fast, and you can see the picture here. I make no excuse for it. Usually they give geriatrics so little time, you have to talk fast, otherwise the message doesn't get wherever it's supposed to go. So without further ado, I'll embark. Everybody see the pictures? All right, hear me?
Yes, sir. Yep.
Well, I have a product in the market, which I just like to say a word about. It's called Lindsay's Elixir of Long Life. And it really is a very new product, but it's a very good product. And I can give it to some of the local people, one of the assisted living facilities here, you see. A lot of people are skeptic about it, but I'll give it to you guys today for 50 cents off, $2. And it's a good product. I'll show you the result. 1 month of my product, and you can see what it does. Very much younger group of people. So it's a really good product. So I hope you'll all be interested in it. Driving down the Blue Ridge, and I usually come up behind cars. The car has this message, Virginia's for lovers. Well, I like to say, I always talk about something that are much broader. The question is Virginia country for old men and old women, part of which is involved very big part in caregiving. So, and I'm asking you today to ask yourself and your agency what role you could do and play in decreasing loneliness and isolation for family caregivers. And I cover my topic, which is really the impact of loneliness and social isolation on caregiver well-being. And I want to give you some general thoughts about the crisis in both adult and youth caregiving. Just spent the day yesterday talking to my kids, and of course, they all do me by text. So as a senior citizen, I have to use some new text material. And you can see some of the things I use here. Things like, HGBM, having a good bowel movement. There are a lot of things. So you have to adapt your text to the audience that you got. My kids are pretty tough sometimes. These are my roots. My dad was a country doctor. My mom was his nurse, assistant, mother of 3 boys, and she had a high school education, but she learned to sew up wounds. She could take x-rays. She could do it, and she saved a man's life one time and putting a tourniquet on his arm when my dad was in the office. So this is my background, and I wanted to practice there for a long time. Then I changed my mind. This is my grandfather. He started the practice back in 1905, and then my dad got there in 1921, and I got there in 1960. And I grew up in this little town resort. You see it's in the mountains. Way over here in the far right, you can see the ski hills over here, the lake country, a very big resort town, but a small town. I didn't want to be a doctor after a while. I decided I wanted to be an Olympic skier. This is my Austrian coach. I went out west to Aspen, Colorado, and took a terrible crash and knocked myself unconscious. When I came to, my right leg was way up behind my head somewhere, and I laid there for about half an hour until I got the ski patrol there. And the question was I was going to lose my leg. So it was one of those things where I had to change the career I do. This is me 4 years ago at age 4. And now, of course, my 2 brothers are gone, one on either side of me there. This is what I look like now, 85 years later. So at 89, you can see the changes aging has wrought. But we exist in a climate where we're seeing 65,000, we're seeing 10,000 boomers a day become 65. So a huge increase in the older population rapidly. And Virginia is no different than anybody else. But we're looking down the barrel of 82 million Americans over 65. And the wave is closer. Inside that wave, dramatic shifts. Big increase in the minority population and subsequent decline in the non-Hispanic population between 2000 and 2020. And we're predicting maybe a minority majority by 2042 in this country. So we'll have to see what happens. Most importantly, all of us need to pay a little more attention to the cultural background of the clients we have. So I maintain we ought to have courses in ethnogerontology for almost all of us at some point in time. Virginia's no different. We're predicting down the road by 2030, 25%, 20% people over 65, huge increase. And the big dramatic thing in demography is this: by 2020, 2022, we're going to have more people in the world over 65 than our kids under the age of 5. So a very dramatic shift in the makeup of the population. I spent a lot of time worrying about chronologic age, but my real purpose in medicine, of course, is functional assessment as a geriatrician. You can see that as you age the population over here, time you get to be 85 and older, many elderly people have 3 or more, if you want to call them disabilities, conditions which are going to require some type of caregiving intervention. A lot of people dismiss that. Think, well, that's not going to be me. Well, you show the odds here for men over 65 who are going to need care, and women over 65, 58% of men predicted need care, and 79% of women. Very substantial group. And what's different about this group is they have all kinds of changes. Their physiology changes, so their kidneys doesn't excrete drugs as well. They have a lot of more than one diseases, diabetes, hypertension, cancer altogether, and they present very atypically. Instead of classic crushing chest pain that you read about for heart attacks, they make you in say I'm not eating well. That's the only clue you have that something's going on. And they don't respond well to some things I do for them. Some of the medications I give them make them sicker. So we get iatrogenic illness. And they need a lot of social support. And above all, the goals of therapy are very different. My goals in medicine are very different than many docs. I don't cure many people from aging, but I care for a lot of people who are aging. I want to maintain function, as I said, because that's the real business of life. Certainly prevention is important. Did you get your COVID shot? The new booster is just coming out now. Got RSV, which is available for older people over 65, and flu. All those ought to be part of our life for the upcoming season. And above all, when the time comes, I want to be able to provide comfort. So much of being successfully aged depends on what you do. So today and tomorrow and last week, what you did in terms of dieting, exercise, so forth, those are the keys to, if you will, having a much longer and smoother functional existence as we grow older. A good example is the Honolulu Heart Study. This curve is for men who didn't walk less than anything at all, didn't get out of the chair very much. This curve is for men who walk 2 miles or more, a 50% decline in mortality between the two groups. So men who walk 2 miles or more, 50% less mortality than men who are chair bound. And we finally come to the realization that there's some real things we need to pay attention to. For years, we've been told about all the hazards of diabetes and cancer and hypertension, sexually transmitted diseases, obesity. Along comes COVID-19, we learned about that. And now what I'm making a case for is we got to have more attention paid to this major public health problem is caregiving, including youth caregivers. So we're going to talk about that today. The big message is this: the vast majority of healthcare in this country not provided by doctors or nurses, is provided by families. The vast majority is provided by people who are not white coats or anybody else. And this is occurring at a time that society is changing. Women are working a lot more, first of all, so the home environment's changed. A lot of single parent and multi-generation households today. Grandparents are in the picture, and above all, the healthcare system is changing dramatically. Increased home care, and you can do complex care at home. Hopkins has a program of hospital at home, as they have many hospitals that they do. Taking care of pulmonary patients, heart patients, with equipment, everything is at home. So it's a very different time. And this portrays what's going on. Over here, the hospitals, the great white palaces with all the equipment, ICUs and so forth. People want to be taken care of over here at home. It's cheaper over here, they're happier here, and more importantly, we can now provide services there. They're very similar to what we provide over here, so it's different. And the other thing that's changed in our society is you can get care anywhere. You go to CVS, you get it done in the telephone booth, you can talk to the people at the Cleveland Clinic on the telephone, and you can get all kinds of care at different locations. Very important. Well, this is a mass of people, and it's a lot of number of people. What's the number of caregivers? Well, this was taken in 2020, but they were predicting it was going to be around 53 to 57%. That's where we are today. Around 57 million Americans are involved in caregiving. A lot of people involved. So it's a big time operation. What's Virginia's situation? This is the most recent data, 2023. We got 980,000 family caregivers in Virginia. 920 million hours of care being given by them. If you paid them $15 an hour, this would cost the state or somebody $14.3 billion. So the question is, if caregivers ain't there, who's going to provide this? And it's going to cost a lot of money, whoever does it. So it's very important. This is where we failed. This science is emergency. That's what I'm trying to convey to you today. There is an emergency. We don't have enough people to deliver the kind of service we're going to deliver. Got all the new agencies being created, things happening. We haven't got enough healthcare workers, mental health workers. Haven't got enough radiology technicians. Haven't got enough nurses. Haven't got enough doctors. Haven't got enough CNAs. We haven't got enough workers in the front trenches. Without that, you can't have any program. So there's one thing we got to do something about. This is a battle we're losing. If we don't start to fix this now, it's going to fail. We're going to be in deep trouble because you can't produce those kinds of people we're talking about overnight. It takes a lot of time. So Lindsay Institute, as one arm of Senior Navigator, was put together to look at problems like this, health of caregivers. And you can see the direct care workers, some 3.5 million people going into homes doing direct care work, 86% of women, 60% of color, and 1 in 4 are born outside the U.S. Of course, immigration policy is going to change this a little bit. We'll see. And despite their value to the nation's healthcare, direct care workers remain undervalued. And the issue remains, and still hasn't been, living wages for these people. What's some of the numbers? Well, by 2025, we're looking at a shortage of 446,000 home health aides, 98,000 medical lab technologists, 95,000 nursing assistants and nurse practitioners. And one of the biggest problems we've heard from a number of people in a small group is Alzheimer's. My mom was an Alzheimer's patient. We took care of her in my home for 3 years. What you see here is we're predicting we've got around 56,000 home care workers. We're predicting we need by 2030, 29% more. And the number of Alzheimer's patients predicted for Virginia by 2025 is 190,000 people. 190,000 people. And this, so you know, is the ultimate caregiving situation. It's tough. So we're going to talk about some of these things as we go along. What about doctors? Looks at 2034, a shortage of doctors of 124,000 docs. The COVID thing has got doctors out of the business. They've decided to take it easy and they're retiring. All kinds of things are happening. At a time we crisply need more doctors. Primary care in some of the rural areas is the only sport we've had. And look at the shortage, particularly by 2034, of primary care docs. Between 17,000 and 48,000 docs. The medical school size classes are limited. It's tough. So how are you going to produce more? What are you going to do? And we're not doing anything right at the moment. So we got to do more. This is a summary slide. This shows you the population of 65 increasing dramatically. This shows you the percentage of people projected who are going to be potential caregivers increasing 13%. At the same time, the population is going to increase 84%. And people increasing with Alzheimer's 160%. So there's a huge disparity. So we're short of workers. And then more and more people are living alone, increasing single person households, many of which are in rural areas, inaccessible to transportation, things like that. So it's a very, very important part of the home care shift. We're going to shift to this thing. We got to provide services to these people who live alone. And then we finally awaken in medicine. You suddenly begin to realize that all of a sudden medicine is a small part of your overall health. Now 10% are due to healthcare. Genetics plays a role, social circumstance play a role, environmental factors. So the social determinants of medicine have suddenly become a focal point, and we don't have the horses to deliver some of the care to them. This gives you some idea of how this works. This is the individual lifestyle, things like whether you exercise, whether you don't exercise, what your family state is. And you're surrounded by your educational level, the environment, things like that, which you've got big impacts on health. And then there's the whole situation of the overall culture that we exist in. All those things are true. Well, every year, the University of Wisconsin does a survey of counties across the country. And they look at what they call health factors. These are things like tobacco use, diet, and so forth. Access to care is looked at. And educational factors are whether you had good education and family support, and over here, the physical environment. At the same time, that all leads up to what health outcomes, the length of life and the quality of life. So they put this in there every year. And what you see here is they map Virginia. And you can see the counties mapped. And the darker the color you see here, the lower the score in terms of all these factors and the quality of life in terms of mortality and so forth. So you can see there's a lot of duplication between factors and if you will, the quality of life. South side, Southwestern Virginia, along the south side, Eastern Shore. So health disparities at least exist geographically in terms of evaluating what we've got. This graph shows you a little bit more hard to read, but if you look at Albemarle County, they rank 6th in terms of health determined outcomes and health factors. Look at the city of Charlottesville, 26th and 17th. Surrounds city of Charlottesville. If you look at Fluvanna County, 24th, but look down here at Wise, Virginia, 121st and 122nd. So you get some idea of what those intensity colors mean. You see a big shift in things we talked about in those given areas. And at the same time, caregiving is always dependent upon the supply of young children coming along to fill this caregiving slot. And you can see what's happened. Women are having half as many kids as they did in 1960. So the pool of, if you will, potential caregivers has decreased very, very dramatically. Does it make a difference? Well, let's look at this. This looks at the caregiver support ratio. That's the number of people 45 to 65 to support people over 80 who need care. And you can see in 2010, there were 7 people available for every person over 80 who needed care. But after that, a dramatic drop has occurred until you get to 2050, it drops down to 3 to 1. So the pool of potential caregivers is disappearing rapidly, and that makes a big impact upon who's going to get the care. Does it help them? Well, let's look at it. 50% of older people who have a long-term care need but no family end up in nursing homes. Half. If you got family caregivers, only 7% do. So it's a critical element in our long-term care fabric, this ability to have caregivers. Lindsay Institute is one of those arms of Senior Navigator. Senior Navigator is a great resource, as you all know, for aging issues and particularly for caregiving issues. We focus on caregiver health in the Institute, and one of the things we learned is that there are 4 kinds of people, as first lady said. Those people are, categorized. Those have been caregivers, those are looking currently caregiving, those expect to be caregivers, and people like me, those are going to need a caregiver. And here's a guy that's going to have something unexpected happen to him. He doesn't know it yet, but something very unexpected is going to happen to him very shortly. This is a lady who we're looking at now, says that caregiving is the unexpected career. She teaches 3rd grade. Last week, she was an active 3rd grade teacher. This week, she's taking care of her mom who was at a stroke. Had to quit the job. Full-time job, taking care of her mom. And we underestimate what that's going to cost. So there's an article big, I guess, the Wall Street Journal, about a family who had 2 elderly parents. And the man had Alzheimer's, he died. The wife was 80 years old when he died. Well, they were looking at their checkbook and they realized that maybe she's 80 years old, we're going to have some problems, but she probably won't last forever, you know. We thought within a year she might be gone. She had several illnesses herself. What they found was that she lasted 10 more years and the total cost of her care was over $1 million, $1.1 million. So when you ask about costs, we realize that costs of nursing home and cash for assisted living is pretty tough. In Virginia, the average cost for semi-private rooms are around $8,200. Assisted living, look up here, it gets up around 40, about half. So semi-privates double the cost of assisted living. And when you assume caregiver job, you got some big challenges. This is based upon some data from 2017, but it's just as good today as it was then. You got all kinds of new mental and physical time effort involved to be a caregiver. Above all, you got to learn how to work navigating our healthcare system, which is no small task. You got big changing in the dynamics between the person you're giving care to and yourself. You got so much you got to learn about all these things about the system in other places, and the financial cost we just talked about. And so many feel my efforts, I don't feel I'm valued. Isolation is felt, we'll talk about that in a minute, and the negative impact of my career. I had to quit work. Same time, you see the work suffers. Work different hours, some have to work fewer hours, some have to take a different job. And the population of caregivers that we have, it's got their own problems. And when you look at the pool of people who are involved in caregiving, they have some common things involved. They have sleep problems usually, they have some history of past health problems, and above all, they don't feel they're contributing the way people think they ought to be contributing. So it has psychological problems as well. These pictures all share one thing in common. These are all people who are caregivers. You can see the effect upon them. And it's a tough job, but the big problem that's common to all of us is the stress produced by caregiving is really something we have trouble with. It's something that plays a role in all aspects of our life, and it takes your health away from you if you aren't very, very careful. People have been looking at things like loneliness and social isolation for a while, trying to figure out at the cellular level what goes on. They found a couple of things. One thing, genetically inside in the cellular structure, more enzymes were produced that cause inflammation. That's one thing we've learned. Second thing, which is paradoxical, at the same time they're releasing these enzymes that cause inflammation, they reduce some kind of chemical which decreases our immunity. So we're more likely to have trouble with chronic illnesses and illnesses in general. And you can see the stress hormones are a big problem. They release all kinds of problems, glucose and so forth. So people begin to look biochemically at the effect of caregiving, and it has a very impact, right, cellular level to the whole body. We're going to talk about. What are the symptoms of caregiver stress? Well, obviously they feel overwhelmed. They don't sleep good, constantly fatigued, big changes in appetite. They may gain weight. They may lose weight. They lose interest in things they once enjoyed. They just don't feel like doing it anymore. They withdraw socially. Emotionally and physical abuse and maltreatment, they may just be tough on the patient they're taking care of. You really get to be mean and nasty. And many of them rely upon alcohol and drugs, and they frequently fall sick themselves. So it's a big, big impact upon health. And that's something we got to impress upon them. When you see somebody in family caregiving role, you got to recognize the fact that they're not going to notice some of these effects because they come on slowly. Before long, it's too late to do very much with them. So mention early on some of the problems that you see in what we just went over. Changes in sleep, physical things, and mention that there's help for some of these things when we go along. We'll talk about that. So caregiving is a life deferred. You don't get vacation. Your job suffers, your family suffers, and above all, you neglect your personal health. I'll put off my mammogram. I'm busy taking care of grandma. Flu shots, neglect flu shots. I know I should take one, but I've been too busy. Doctor visits are changed, exercise is out the window, and they don't relax. So everything suffers from caregiving. And this gives you some idea how it impacts it. A lot of them quit going to the dentist. 30% of them stop going for a dentist, have their teeth cleaned, don't get their vision checked on time. They have physicals, routine stuff. Now I'll put it off another year. I'll get that done. Prostate exams, those kinds of things are neglected. And the result is a litany of diseases. Significant amount are significantly depressed. They have significant headaches, heart problems, weight problems. All these things are disease results of some of the stress of being an adult caregiver. So I teach everybody that I talk to, the medical students, nursing students, that the first rule of caregiving of any disease is that the care of the caregiver is the most effective treatment for the person with Alzheimer's or any disease. And so this is fully understood and embraced by everybody. You're in danger of losing the caregiver. So the first rule of caregiving is that the care of the caregiver Something has to be done by the family, whoever's going to do it. And there are a lot of ways you can relieve stress. And some of these are worth mentioning. One of them is practice self-care. I heard this morning somebody who said, I just haven't been taking care of myself because I haven't had time. You've got to build into your time schedule as a caregiver some element of self-care. Because if you don't, you won't make it. And above all, you got to learn systems and so forth like that. Meditation helps. Positive things like attitude, those are easy to say. A big list of these things is giving you a little piece of paper so you can do all these things that'll relieve your stress. It helps. It's not the only answer, but at least it's a start. It's a help. Now, this is some stuff from my partner in this whole operation is a lady named Rhonda Zingraf. She's a doctor, former dean at James Madison. And James Madison has a program where they take the college students and they train them to be caregiver assistants for people who have Alzheimer's disease. What they do is they go in the home and they tell the caregiver, we'll take care of what's going on here for a while. You go get your hair done. You get your doctor visit done. You go shopping. You do what you want to do. And pretty soon they're part of the family. I interviewed a family not long ago where they were part of the family. And they're an invaluable part of the family. So you can train people. College students are a good market to do this kind of thing and finally give you some relief and give you the respite care. Now, the other thing is the medical profession is at fault. And I fuss at them every day about this fact. Question, are you or any of your doctors, the person you provide care for, aware of somebody doing a caregiving role? And 20% of the time, neither doctor has any awareness of that. And down here, this is the question that really counts. If any of your doctors, the doctor or the person you provide care for, made suggestions about how to better take care of your personal health, telling the caregiver that you've got to follow some of these rules to improve your health. And 44% of the time, the answer was no. Now, part of that's due to the fact that family members may say to somebody, don't tell anybody you're doing the care. We'll talk about that a little bit later. We'll go on that. So the basic lesion in caregiving today is this. The system doesn't ask, and the patient doesn't tell. And that's got to be corrected if we're going to make any inroads in this overall problem. We'll come back to that again. And I have a personal complaint about the current system. This is a cartoon drawn by a family, mother, sister, and the other sister's getting care. She's at the doctor's table over here. Where's the doc? Doctor's over his back to the patient, entering data in the computer. And he's on a 20-minute time limit. Because if he doesn't do that, the hospital doesn't get paid. So the system is built as this built-in flaw where they give you enough time to adequately make sure some of these things we're talking about are conveyed to the patient. They don't ask, they don't tell. Then I asked the medical students, I showed this slide to the 167 new first-year students last week. I said, what's wrong with this lady? Well, they give you all kinds of exotic diagnoses, things you don't see once in a lifetime. What's wrong with this lady is loneliness. She's looking out the window and she's another lady. Outside, there's the world I want to be part of and I can't be for whatever reason. Now, they did some surveys. What they found that 24% of community-dwelling people over 65 are socially isolated, first of all, and 4% were severely socially isolated. And then 43% of adults 60 and older reported feeling lonely. And 13% of them said, they really had awful symptoms of loneliness. So we're going to talk about both of those things. And there's a confusion. They aren't the same. Loneliness is an individual perception by the person of the fact that they're not being where they want to be. They have a chance to mix with people with you, so they feel lonely. Social isolation, on the other hand, is the objective lack of any kind of contact with others. Two different things. And you can be surrounded by people and still be lonely. So a very important difference. And loneliness in caregivers is caused by the fact that they had previous routines. Went to the office and they had, coffee breaks, saw all their friends, caught up on social activities. That's gone. Caregivers don't feel like they cannot set aside their caregiver responsibilities, connect with their friends. So it's critical. What are some of the reasons that caregiving makes them lonely than other people? Well, first of all, little time for group activities. Friendships are, very superficial because they don't have time to do it. Many of them realize that there's a social stigma attached to the fact that they're now labeled as a caregiver, particularly for dementia patients. And friends they had will avoid them simply because they're worried about what their problem is, and particularly Alzheimer's, things like that. And many older people can't drive anymore, so they're really isolated. How are they going to get to where others are? And above all, they don't want to burden other members of the family. They don't want to share their feelings, so they keep it all to themselves. Meanwhile, they're just tense as a fence and all kinds of stress going on. And all this loneliness gets bumped and shoved aside as caregivers are dealing with problems that they got. And the technical solutions that are offered by all the agencies we've got and so forth are unavailable to them. They have not got the time in their minds to do this kind of stuff. So they don't want to participate. So it's a real interesting thing for caregiving. Socialization, on the other hand, is associated with 29% increase of all risk mortality. 20%, 30% people have this increased risk of mortality just because they're socially isolated. Loneliness, higher rates of clinically significant anxiety, depression. We know that. Also, a 59% increased risk of functional decline. They really become, by Lindsay's criteria, which I look at, function, really invalid. You can't function. And poor social relationships have all kinds of problems. So these are some of the issues. How do you quantify loneliness? How do you measure my personal feeling that I'm not, able to do what I want to be and where I want to be? Well, there's a lot of scales out. This is one from UCLA, 20 questions, and they rank it. The scores range from about, I guess the scores range from 20 to 80. The lower score means you're not very lonely, and the 80 is higher ones lonely. But it doesn't necessarily give you the data we want. It's used for research, but it's difficult to quantify loneliness. So that's one of the problems that medicine has. We're working on that. Another, this is a scale for loneliness. This is for social isolation. What you see here, question is, how often do you feel that you lack companionship? How often do you feel left out? How often do you feel isolated from others? 4 questions, and they're ranked again, and the lower the thing, less lonely, the higher the score over year. So they do try to quantify it. All these social things we're talking about, social isolation and loneliness, are changed by things like risk factors. Family support, no family support. Health impact, did it cripple them up? What to do? And then the ultimate result could be death if you aren't very, very careful. So, tough thing. And this is a summary slide, kind of like loneliness seems 59% risk of physical and mental health decline. Loneliness causes dangerous smoking. We'll see that once more in a minute. Depression, high increase in this. We talked about that. Seniors suffering from loneliness have a 64% higher risk of dementia. So right away, you get some idea of the seriousness of loneliness. It's a tremendous impact factor on health compared to the caregiver. We did a study right before the COVID, and this study found that there were 25% of older people were social isolated, and 43% said they felt lonely. This is before COVID, before 2020. And when you get around looking at what it does, loneliness and negative health risks, premature mortality from all causes is significantly increased by being lonely. 59% increase in risk of functional decline. We talked about that. Increased risk of developing dementia. So it has a huge impact. Then there are other ways that people look at. This is one way they look at the number of in-person meaningful contacts you've had. And the more that you've had, the lower your score, the risk for loneliness. So personal interaction, contact is a critical thing, and that's often missing. The British are way ahead of us. I went to Britain as a traveling fellow for the Royal Society of Medicine. And when I got there, way back in the early 70s, they had a lot of things going on for older populations. More recently, they did a study looking at the impact of loneliness and mortality. What they found was that a 50% increase in survival for those with strong social connections after 7 years. So 7 years of study, and half of those people survived when they had good social connections. If you have weak social connections, that's what it comes to smoking 15 cigarettes a day, you're going to be an alcoholic, or harmonic. So right away, it just ought to elevate everybody's awareness of the fact that loneliness and social isolation have a huge, important role to play and need to be corrected in terms of some of the problems we've got with illness in this country. Britain takes it seriously. They have a minister, cabinet minister, whose sole responsibility is to be looking at the programs to cut down the rate of loneliness. They do things like this. Park bench in Britain. A week later, I went by the same bench. Sign says the happy to chat bench. Sit here if you don't mind someone stepping, say hello. Everywhere you look in Britain, they've got something going on. They created something called men's sheds. What is that? Well, I asked somebody, they said, well, men don't talk face to face. They talk shoulder to shoulder where they're doing something, building something. So they put together a setting where men could come together once a week, and they build benches and things like that for parks and volunteer agencies, and they do a great job. So another way of getting it. Now we've got that in the US, some, and other countries have adopted it very well. So it's just a thought. Well, in 2020, along came the bad bug, COVID-19, this virus. Right away, they put in place things which really interrupt social connectedness and things that go with loneliness. And this is a classic example. This is a woman's 90th birthday. You can see her face through the glass over just a little bit. And science ever, one of the granddaughters missed you. Well, both sides of that glass missed me. They missed her, and believe you me, she missed them. And it just destroyed the population in long-term care facilities for many reasons. Well, I'm a member of the healthcare team, and I'm in the healthcare. Say, what healthcare could be doing? What could we be doing? Well, first of all, we got to figure out a way to quantify things like loneliness, and be able then to react and put something in place in the healthcare system to fix it. And above all, general public awareness about loneliness and its impact upon health has got to be conveyed to every citizen, so they begin to pay attention to it, like they do for diabetes, hypertension, those illnesses we saw in the sign. And above all, everybody who trains to have anything to do with caring for people has to have part of their educational system towards looking at the issues of caregiving and loneliness. And above all, the system needs to make some ties. So let's look at that. This is a guy who has a student many years ago, Joe Smith. He practiced in Southwestern Virginia. He's a pulmonologist. Oh, here's his dad. He served on the governor's advisory board with me for a long time, but they were big contributors to aging in Southwestern Virginia. Joe realized right away Southwestern Virginia had a big population of Mayan people, and there were a lot of x-rays needed. Well, I had to travel somewhere to get the x-rays taken. Had to go to Roanoke, had to come here to Charlottesville, all kinds of problems. So Joe, on his own, learned to drive an 18-wheeler, and then donated the 18-wheeler loaded with x-ray equipment. They used a mobile unit, take it around, and the people that don't have to go anywhere, they bring it right to their town center. So that's one tip, a single guy. Telemedicine made a big role in the answer to healthcare during the epidemic. And it's an amazing help in rural areas. But that's something that again, has limitations from many aspects. Then one of the critical times in the caregiver's career is when the person who takes care gets sick and gets sent to the hospital. And some hospitals have already made some real inroads. I just want to share them with you. This hospital's got a place called the Ken Hamel Caregiver Center. What is that? Well, it's a room in the hospital where people who've got their loved one involved in caregiving diet up in critical care. They're upstairs, they sit at the bedside, they're tense. This is a place they can come down to really relax. They can watch TV if they want, they can sit quiet and listen to music. Computers there, you need to catch up on computing, but it's a little bit like home. And above all, it's filled with people who got the same worry. Caregivers whose loved ones in the hospital and very, very ill. And then I was in the emergency room last year for something, and I ended up in a hall just like this. It was not a pleasant place because there's action going on, people being wheeled by, all kinds of stuff. All the rooms in the ER were filled. Well, a hospital like Mount Sinai in New York has created part of the emergency room they've set aside for older patients. And notice the difference in the atmosphere. Lighting is different. Quiet room, quiet place, and a chance to really be at least at peace while you're waiting for care. Then I read it not long ago, an interesting thing that happened in France. With the COVID epidemic, the male volume decreased by a significant percent. So the male guys had a lot of time on their hands. So what the government decided was they had a program during the summer, during the heat epidemic, where they asked the postman to check on people during the heat epidemic. They put in program in place for the paper $22.50 a month. The mailman stops in once a week, determines what's going on with the family, sees the need, and then contacts the family. And then monthly sends a summary to the family of the individual that they're following. $22.50 a month. So the postal service, because somebody goes in the home, is somebody who can use some value. Then you got communities like Elder Spirit down in Abington. Basic whole idea of places like Elder Spirit is that you're there, but you're part of a community and you're going to help everybody in the community. And they give you a partner, and the partner is assigned to you. You be good friends. When you get hospitalized, the partner is your visitor. So there are a lot of ways you can do it, but this is some of the things that are done. And then all the new devices in society have made a big difference during the COVID epidemic. Phones, we had some of the agencies like Jefferson Area Board for Aging, which I'm involved with, just did a masterful job of making sure people were contacted. All the staff of the main facility, which was closed, got on the phone, called people once or twice a week, see what was going on, that kind of thing. And there are a lot of variations of that whole database exchange, but it's good. Then sometimes you can get some respite care by getting art therapy program for the patient, like Alzheimer's disease. They love to paint, some of them, and the person can be involved in doing something else in the meanwhile. And then there are whole things for just nothing but caregivers. The difficulty here is find the time to do these things. And many caregivers won't do it because they just don't take the time. I was getting ready to make an article, publish an article on caregiving. I was commenting on the big holes in the fabric. Such a critical part of our healthcare system had big holes in it. I ran across something in the British literature called youth carers. I said, well, I'm a youth carer. I had 3 kids. I raised them, took care of them. That must be, I'll read about it. All of a sudden I read about something, the term came up, youth caregivers. I said, what is that? And the British, and in this case, Canadian literature, suddenly put before me a whole idea which I hadn't thought much about. The fact they have a large population of kids between the ages of 8 and 18 who are giving care to adults. A critical part of the fabric of our healthcare system, and I knew nothing about it. And the more I read about it, I realized that down when they look at see where systems are in terms of their awareness of this whole thing, down in 5th place is something called emerging programs, and that's where the US is. Up here, the programs like Britain, Australia, really advanced programs already in place for the support adult caregivers. Then I saw an article in the Atlantic Monthly. This guy said, how can it be that so many people like me are so completely unprepared? Well, it's after all one life near certainties, caregiving. He said, we should all be given time off to work at age 40 to take a class on elder care. I said, well, geez, my kids are all teachers. Why not put it in the school system? So a motto became, why do we teach CPR, which is a critical skill everybody should have, but the chances you're ever going to use it are very small, unfortunately. But this is not something that you're going to be not part of. I told you before, it's out there. So we set out to put some in high school. We did that. But first of all, we need to determine how many kids are there. Well, right away, we ran into a problem. We had some generic questions on trying to find out how many people are doing caregiving in this population of high school kids. And the high school said, no, that's too invasive. You're going to get too much information. That's not good. So we tried a much more generic series of questions. And even that's under siege. So it's tough. So we put a class in place in their healthcare curriculum that they had called Caregiving, a Hidden Healthcare Crisis. Right away, we told them, you guys are the keys. You're taking care of somebody, and you've got to learn a lot of different things. You got to learn how to deal with hospitals and clinics. You got to learn to deal with lawyers and wills and so forth like that. You got to know what's out there for community services. So we try to train them in all these various areas in some aspect. And they're the coach, and the coach and the whole team. And you think of kids in caregiving, you think, well, maybe the kids, changing messed pants, or maybe kids helping them get up out of bed, getting out of a chair. No. Today, the kids are doing, this is a young lady of 14 who's changing her dad's trach tube. This is a guy who had his larynx removed from cancer. Here's a 12-year-old giving his mom a shot. And other things are involved. They have to learn how to prepare and give special diets. And above all, they're involved in daily medications, including IVs. And they've had no training at all. So right away, the high school curriculum assumes great importance. But at the same time, the caregiver, unrecognized by most of everybody in the school system, is a patient. So she's got all kinds of problems, and they're a problem student. Comes back to the old question. Nobody asked them, and some people, particularly in children's youth caregiving group, the family member has been told by their parents, do not tell anybody you're giving care. Because if you do, you'll be taken away from us. So you don't really know. And any estimate of what's out there, we don't know. But it's the old story. Over and over again, I see young Johnny bring his grandfather to the desk at the hospital clinic. And he says, here's Mr. Smith. Clerk behind the desk says, thank you, Johnny. Go over there and take a chair. We'll take Mr. Smith inside. So Johnny sits over there in the waiting room. Mr. Smith's inside, and Johnny is the only guy who knows when he's taking his medications for diabetes or following his diet. So the medical system misses a big opportunity for vital information exchange simply because nobody asked, and you're not going to tell. So I tell the students that the first thing they do when they interact with the healthcare system is says, I am the caregiver. My name is Dick Lindsay. And if that doesn't work, get a tattoo. That's the whole thing. What they make you is this. I then began to look around for more information. Well, I ran across something called the American Association of Caregiving Youth in Boca Raton, Florida. And right away, they told me their kids taking care of grandma, siblings, grandma again. Here's a kid taking care of her mother who's got cancer, giving her critical medications. So young carers between the ages of 8 and 18 are a vital part of our overall fabric, and nobody pays any attention to it. Down there, we've come across the fact this is the only organization in the U.S. that's solely responsible for caregiving youth issues. I'm now on the National Advisory Group, and we're very, very busy. The last estimate we had for the total number in the U.S. was somewhere between 3.4 and 5.4 million, recognizing that half of them aren't going to tell you. So we don't really know. And we just got this spring that in the Youth Risk Behavior Survey, that whole idea of that, what we can talk about, we got one question on that. What do we do in the AACY? Well, first of all, we do all kinds of interesting things, but we basically focus on issues of youth caregiving. And it's one of those things that we just got to do more for. What's their impact of this whole program of giving care on youth and their education? Well, I found in Florida, of the young adults who dropped out of school, 22% said it was to care for family members. They miss school all the time. They're late for school all the time. They have trouble completing their homework because they're busy doing other things. They average 20 hours a week. They can't participate in after-school sports. They become isolated for friends. They have abnormal adolescence, essentially, because they can't be part of the normal society. And our program, my attempt to model the one in Florida, we have skill building classes, workshops, and we have lunch and learn sessions where we bring the kids in, get them together. All of a sudden, for the first time, they realize they're not alone. There are other children that have just the same problem. They're caregivers, having trouble with schoolwork, and they're having trouble meeting all the social things they'd like to have. And we do things for them, like linking up families with resources. We have social work evaluation at home, that kind of thing. And in the summer in Florida, we have an overnight camp, things like that. We hope to build that in our program here in Charlottesville, get done. And again, under the age of 18, these are minors. And they do all kinds of things, as I mentioned to you earlier. Now, what are the results of the program? In Florida, this is what they found. Huge increase in caregiving skills of these kids. They really became, especially nurses, they're good caregivers. Feel better about themselves. School grades improved dramatically. They make friends who are doing the same thing because they're all involved in the same stresses. They learn how to manage stress. We have little time to enjoy some activities outside. And above all, just like we said for adults, they begin to focus on the fact they've got to care for their own health because they have the same result that we saw in the adult population. They develop depression, they have anxiety, all kinds of things. Grades improved, as I said, and we'll talk about some other things that come along. And then we got this whole new thing called grand families, where 41% of the kids who live with a grandparent are being raised by the grandparent. More common among Blacks and minority populations. But 43% of these children, there's no parent in the household other than the grandparent. Now, does the grandparent have dementia? Nobody knows. More importantly, what's the impact upon the grandparent? Same thing we talked about earlier for the adults. So it's tough. And then along came the opioid epidemic. This is some data from 2017. 240,000 kids have had a patient who died from the opioids. 10,000 kids who've had parents who are now long-term in prison for opioid offenses. And it's gotten worse. It's not any better than it was in 2017. 21, British did a survey of young carers. What they found was that the COVID epidemic just magnified all the things we've talked about that were there before COVID, but were never paid attention to by anybody. So one good thing that COVID did, it covered the important role that caregivers, both youth and adults, play in the overall fabric of long-term care in the country. And that's a big price to pay for that discovery, but that's what was done. More recent survey done in 2022 of adolescent caregivers found that 14% of them reported they thought about hurting themselves, suicide. 6% reported they thought about hurting somebody else, including the person they care for. So you got problems. Many of the kids today are taking care of a veteran from our Middle Eastern wars. And post-traumatic stress comes home, and we found that adult caregivers pick up the same symptoms that the person that had post-traumatic stress disease. That same thing has happened to kids. So it's another tough thing for this age group. So what they need is counselors. And school systems are good. They've got a lot of problems that need counseling today, but we need more. And mental health, just as due in our recent budget, we've got to pay more attention to mental health. And we've got to provide more mental health personnel without question. So there's a couple of policy recommendations that I have adopted from a national report. And one of them is this. You tell everybody in the school that they should have policy interventions to educate and to empower the staff, including nurses, counselors, administrators, to address the needs of the population, schools at home. And above all kinds of current and state federal policies that require schools to routinely identify other vulnerable population of kids who may benefit from different things, like, for example, learning disabilities, homeless. They have to be identified and provide different things for them. Students who are caregivers should be afforded the same comparable recognition and service. They should have flexibility regarding classes and exam schedule because they get caregiving responsibilities home, so they can't show up. Above all, students count caregivers as part of their service hours for high school graduation. Education about caregiving use should be part of every curriculum for all healthcare workers. Everybody who involved in the healthcare system should have some segment of their curriculum having to do with this, what we're talking about. And this is particularly true for, PAs and doctors and so forth. Well, along the way, we've learned that kids do get some rewards for caregiving. They have a special relationship with the person they're giving care to. They develop mature life skills. They feel they got a sense of purpose taking care of somebody, and they learn about empathy. But this is the big one. Many of these kids in Florida found that what they found was an interest in a career, a health-related career, at a time we need desperately more people in. I've shown you that in healthcare careers. So here's a place to fertilize what we need desperately, more people in healthcare. And so we take them, they learn the healthcare pathway. They see people like dentistry, maybe a dental assistant. They work in rehab, podiatry, maybe they don't want to be a podiatrist. But above all, significant numbers of these kids are attracted to healthcare careers. At a time when we need more healthcare workers, these things, this is a very good source. And above all, we tell them go out in the community and begin to tell everybody the importance of what you're doing and be available to make sure that the community focuses all the time on caregiver support services and every activity the community thinks, legislative and so forth. We have a hackathon every year for teams from 6 universities in Virginia, bring them to Richmond for 2 days, ask them to develop a product that will have some impact on caregiver health. On the team, we always have a caregiver. These kids come up with wild ideas. Caregivers say, I don't need that. Here's what I need. And they come up with some really, really interesting products. And out there are some products that today kids learn to work with that we never had. Virtual stuff is just for many people with dementia, it's the answer. It calms them down. There's old pictures and so forth. Just another example of how a generation of people who are used to technology have learned to employ it in the healthcare career. And then the critical element for all caregivers is, geez, just a minute off, just a little chance to just do what I want to do for a minute. Because by the time people begin to realize that they're approaching burnout, they're beyond fire. And I told you about the group up at around the Zingrad for this, taking the caregiver into their family. Just an example of the kind of thing we're talking about. And I grew up in a household where I used to go with my dad making house calls. When he let me inside once in a while, he'd show me that he always had the person who was the caregiver involved making the decisions about the patient. That's something all have got to learn. Always. One of the key members of the team is the person who's giving the care. It needs to be involved in all decisions at all levels. So I tried to adopt that. I never gave up the idea of house calls. Rural road in Virginia, my team was there, a social worker, a couple of my students, the man who lived in the trailer with his wife, and didn't have hot water. So somebody in the social world got an ID, needed hot water, and got it installed. 2 days later, he took an axe and chopped it off. Didn't feel he was involved in the decision in the first place. This is the lady who, when I go to big house calls on her, I have to disarm her first because she fires a warning shot when you get there. So you know, it's interesting. But when I get there, I learned something else. That there's no substitute. You can't simulate any way what you can learn from going into somebody's home. Seeing what the territory is like, and above all, seeing them in their turf, on their terms, not on our terms. So the value of the home visits for all people, and that's what we got to harness. Anybody who goes in anybody's home for any reason, male, whatever we're talking about, we should figure out some way to employ them in what we're talking about. And I close by just saying, the question is this a sunrise or a sunset? Well, somehow my own particular bent is, of course, to increase awareness, the adequacy of youth caregivers. We got to do the same thing for caregiving in general. Got to make sure that everybody understands that caregiving has a major negative impact on health. And to prevent that, we got to have places and teams to help them. And above all, we need to have increased awareness of the careers that are out there that are so desperate to provide the service we're talking. So I'm going to close that note. Thank you for your attention today. And that's what I had to say.
All right. Thank you so much, Dr. Lindsay. That was great, insightful presentation. I know I learned a lot. Does anybody have any questions for Dr. Lindsay?
Then I can answer. Make sure they're the ones I can answer.
Yeah. I know a lot of people in the chat were saying how valuable they were feeling that the information was.
Well, we're going to try to make, right, I'll help Nick. I'm going to get Nick some of what I present. Some of what I present picture-wise, I can't release because it's copyrighted, but otherwise it's, I'll try to put together something we can, with some of the figures on, and get it to Nick so he can distribute it.
Awesome. Awesome. Okay.
This is Amy Phelan. I have a question. Just wonder your thoughts on long distance caregivers trying to provide care for loved ones. I think that's got to be more common now with people having moved for jobs, etc.
Absolutely. And so the long distance caregivers are at a disadvantage in the sense that they can't be there personally. And there you get the dependence on what we're talking about earlier, local area agencies on aging, and many of the local organizations which you represent are in place. The question is how to link them up with that. And that's one of the things that I think Senior Navigator can help with. There's a lot of links there, but above all, there are other places you can find the information. Alzheimer's Association's got a lot of links, and utilize that with the help of because they're vital. They play a role that you can't duplicate. They're at least somebody that the family knows and that kind of thing. So long distance caregiving, as you say, is becoming much more common, and it's tough on people who live long distance away. And it's tough on the family, the recipient of caregiving. So it's a big problem. I don't have a glib answer to it. I mean, I think it's something that one of the things that caregiving needs more research, particularly youth caregiving. It's just beginning. People begin to look at it with any critical eye, and it's difficult to measure some of the things we've talked about, social isolation and loneliness. You can understand the concept, but measuring is a different story because there's so many factors involved in it. It's hard. So it's a challenge, but I think you bring up a very good point. Thanks for bringing that up.
And the other thing I wanted to add too is I think in the rural communities where my mom resides, there's a lot of community support. The churches will drop off meals, the local store will come, the manager brings food. There's a lot, it's a different way of caregiving, I think, because there's more involvement. I
think you're absolutely right. I grew up in a small town, and the neighborliness at that time was a very small town. When somebody was sick, the town was aware of it, and they took care of it in many ways. Brought food into the people, things like that. In an urban area, it's a different ballgame. And that's where the big problem is. In urban areas, it's really tough to do that. And it's tough to know. That's why I like the village concept. I like it when they have it in Abington. I mean, it's a reasonably priced place, but the basic spirit there is one of neighborhoodness, bringing help together from the people who live there. And to the degree that we can emphasize that and build on it would be a great, great idea, I think. But you're right. That's a key point.
I have a question.
Okay.
The program about the caregivers in high school, I spent 23 years as a school nurse and also an educator in different aspects of it, like family life, sex ed, and things like that. How successful was your curriculum in the school system?
Well, we've only been there 1 year in terms of functioning. We've been 2 or 3 years in planning. We started at the very beginning of COVID. You can imagine what it's like to bring a new idea and a new program to schools with the COVID epidemic at the same time. The answer is we were put aside, and rightfully so. But as the COVID epidemic has calmed down, we've allowed to get things going. And what we found, of course, is very early on. What we found is that I think the kids themselves are the best ad for the program. What they say is that above all, they understand they're not alone. That's key point number one. And we provide, I think, an invaluable service, but just that one thing. But more importantly, they then go back out in the community and they become our ambassadors. That's exactly what we need. We need everybody to make the public much more aware of the fact that this is a program that's out there and these kids need help. They need to be identified, first of all. We need to find out how many of them. Virginia doesn't know. If I asked Virginia to say how many youth caregivers out in Virginia, nobody would know. Nobody would know. And yet it's a vital piece of information that we need to find out as quick as we can. So that's why the youth risk behavior survey, which we've done, every 2 years, at least we got one question on it. But there are other questions we need to know the answers. That's one thing. But you're absolutely right. It's a problem that I think we're going to see more of, and we need more help. And school nurses are a vital link. The nurses, we have an advisory committee for the program. The school nurse is the key player on the thing. And she gets, of course, she's the focal point for many of these kids.
So how many, what school system are you in and
we're in the Albemarle County school system, only one school, Monticello High School.
Monticello. Have you ever considered going to the Department of Education under the physical and health education people?
And we've done that. We want to get on their program, the annual program, and present our shop. Hope we do that this year, but that's a critical player. We've done some other things as well. We've also tried to get the University of Virginia's School of Education and their School of Business to become aware of youth caregiving. We want to be part of every School of Education first-year curriculum so that when kids going into teaching, they would know that. I lecture in the nursing school, so that's on the nursing school program, the University School of Nursing. We have a program on caregiving. Same thing is true of the medical school. I have a part of the first-year medical students that I showed a little more what we talked about. You saw it today. So trying to make more and more people aware of what this problem is and get them involved in it. The pediatric program, for example, that's where the people go for healthcare. And as I said, they've been told not to say anything to anybody about what and the pediatricians never asked. So docs have got to have that one question as part of their basic approach to any patient. They've got to ask, are you the caregiver? What's your role in the caregiving at home? And that's not being done. So we've got to get that done in nursing school and medical school. So those are places we can also talk to. And you're absolutely right. Nursing education is a critical part of it. That's one question they ought to ask everybody. And they can be very, very helpful in the overall program. The nurse has been invaluable to me. She knows, students know her, and she's looked as a real resource. They go to her first. Thank you for your school nursing. Those are good people.
Ralph, did you have a question? It looks like your hand was raised.
Yes. I'm a 24/7 caregiver. Been doing this for about 3 years. But for new caregivers that are suddenly thrust into caregiving, let's just say their loved one is in a rehab center, about to come out in a couple of weeks. What are the top 2 or 3 things that a new caregiver should do?
I think the first thing, Ralph, that's a very, very valuable question and point. First thing they should do is try to get some place where they can get some education about the basic problems that caregivers have and skills they're going to need. And I turn, as I said, one of my places I do a lot of work with is the Jefferson Area Board for Aging. So the area Ages on Aging is invaluable, but find out locally who the resources are that deal with, and many of you represent these sources, caregiving, and employ them in some way in introducing this lady to some of the basic skills and some of the basic problems she's going to have. And it's a good idea to do that in advance. If they know somebody's coming out of rehab, you're going to be home, you're going to be involved in their care. then to the degree that is at all possible, do this in advance of the person arriving through the door. Because after that, it's the first 3 days, as you know, and get somebody home in the hospital, it's chaos. And I think it's very, chances of going somewhere and having classes are going to be pretty small. So if you have a health worker who's going to see somebody when they're discharged in the patient's home, that's nothing they can do in the first couple of days. Say, look, we got a program at our facility where you can come in maybe for an hour or two and spend a little time with us. We can help you get some of these skills you need. And the community can do a big job there. That's a very, very valuable resource. And many of your agencies that you're representing in this group today are ones that are just vital to this problem. So hooking them up is the thing. And above all, we got to get the healthcare system to make sure that they begin when somebody's getting ready to come home, not the day of discharge, letting somebody know that they're going to come home. The more advanced warning the system can provide about somebody who's going to be a home care, a recipient of care, and will need caregivers for it early on, then they can do some of these things, and many do it before the patient is discharged.
Thank you.
Thank you, Ralph, for asking.
All right. Any other questions?
Good morning. I don't have a question, just a statement. Thank you so much, doctor. That was an amazing presentation. I'm a caregiver for the past 3 years, and I just want to share that, we're talking a lot about health and social. And, one thing that's key is finance. A lot of times people who are caregivers either have to change how they work or not work. And how do you maintain your lifestyle or some form of lifestyle? When you are, a caregiver, you no longer can bring in the money you could when you were a caregiver, so for me, that's a big struggle for us. I'm a business owner, so I'm able to do some flexibility, but when your doors are closed, there's no money coming in. So it definitely is a struggle. And when your loved one doesn't qualify for Medicaid, then mostly everything is out of pocket. You know what I mean? So it's almost like it's either be on Medicaid or put them in a nursing home so they can get Medicaid, which I feel is a huge issue in the state of Virginia. There's nothing. My mother taught for Hampton City Schools for over 30 years, and the city is not doing anything to take care of her, to help me take care of her.
No, I think that's a major issue for the whole country. And I'm glad you brought that up because, very honestly, I learned that my mom was going to come and live with my 3 kids and myself. I was divorced at the time. And basically it was a thing where she was causing my other brother a lot of problems. And he just couldn't take it anymore. So he shipped her down to me in Virginia. And she had very advanced Alzheimer's. She thought I was my father. In fact, one of the things that used to amuse my children was when my mother and dad used to go to bed early. So 7:30 or 8 o'clock in the night, we'd be watching TV, and my mom would turn to me and she'd say, Bob, which is my dad's name. She'd say, Bob, it's time to go to bed. But my kids would always laugh at that. That's the kind of problem we had. It was like a nuclear explosion in my home. I had 3 high school age kids and my mother. And I was busy working at the hospital. And I can tell you right now, arranging help and qualified help was tough to do. And it made me aware of the fact that I was not a very good caregiver. And I preach caregiving to people, but when I'm in the trenches, it's a different ballgame with your own mother. And I think that all caregivers will have that feeling. It's just one of those things where it's all consuming, and you got to figure out some way to get help. That's why what we're talking about is innovative ideas about who to employ. And some programs like Maine has a program, I think they take high school students and they send them out to their people who are sightless. We have to begin to think of innovative ideas of involving a population that can be very, very useful to us, has their own skills and talents, like high school students. And we're doing that with that. And it just is amazing what they'll do and what you can train them to do. And they become very, very mature about some of the things they do. And so that's, I think, where the answer lies. We've got to find out a better way to harness a volunteer population like high school and college students to provide some of the things we need desperately. We need respite care, need people that can come in and provide transportation. Because that's a big thing we got to have. We got some of the rural area people who live alone, get them to see the services and stuff. And more importantly, we got to provide more outgoing services. We got to provide more services that are used to taking care of people at home and not in a building somewhere. And I think you're going to see that more of that, and we are already. And that's very important. And I think only when we get that going, and that takes manpower. And manpower is the one place we fail. We have not planned for what we need, and we're in trouble. Because the long-term time it requires to train some of these people is going to really have a tough impact on the caregiving population. It is already. And I think we got to get the government involved. The government has got to recognize what we need. In Britain, for example, they recognize youth caregivers. They're provided with financial support. provided the programs to support them, just like we talked about here. And it's part of the government's needs. And as it is now, there are adult programs for caregiving, but very little notice is given to youth caregiving. It's potentially a key element in the fabric that holds our whole system together. So we need to heighten awareness of it, need to get more people about, and above all, we got to get the government backing it. So you can all help with that.
Thank you.
All right, well, I've enjoyed visiting with you. I hope I've got something across the board to you. Hope we can do it again for too long, I think. Thanks very much for inviting me. I really enjoyed it very much.
Yes, thank you, Dr. Lindsay. Before we go, Juliana, did you have a question or wanted to say something?
I did have a question, just a quick question, hopefully won't take much time. You were talking about innovative ideas of how to provide care, especially when it's so caregiving can be so expensive. I don't know if you're aware of the au pair programs for children in which nannies or young adults are brought from different parts of the world through a student program to care for children, and they are with a family for a year or two. They are paid, they have a contract, but their flexibility is based on that family's needs. And I was looking into this, and I know Europe has a very similar program for older adults. And I wonder if you have heard about anything like that here in the United States, specifically for older adults, because I think that right now the staffing is finding people. It's very difficult and expensive.
Right. I've heard of programs where there's a monetary reward for the people who do it. So, I mean, there are programs like that, but I've not heard of the specific one you mentioned. So thank you for bringing that up. I'll look that up too. That's a good point. And again, that comes back to the basic issue that you cannot underestimate the tremendous expense involved in it. And we don't have much, we have no long-term care insurance. And if you buy long-term care insurance, as you know, you got to buy it early to get the benefit from it. And it's very, very expensive and getting more so. So the issues around financing for long-term care and caregiving as part of it are very, very real. And I don't know what we're going to do, because as I said, if we had to replace the voluntary system we've got, I showed you what it costs to replace it in Virginia alone, $15 billion. That's a lot of money. And yet it's an invaluable part of keeping these people at home in a happy environment. And the price is paid for it, paid by the caregiver, just like you're saying, both financially, quit their job many times, and the personal expense and illness that they acquire from is tough. It's a very, very difficult career. And the Alzheimer's patients, having been close to my mother, I mean, I had no tolerance for the fact that I would tell her something, and then 3 seconds later she would forget it. And I'd say, Mom, I just told you that. You know, there I am. I tell people that's the worst thing you could possibly do in the world. So the stress of caregiving is a very real thing, and I think it requires, as I said, requires training. Ought to be part of every standard high school student curriculum. And it's something that we all ought to know about very early in life, because it usually comes as a surprise. When it does, it upsets the whole apple cart.
Yeah. All right. Well, thank you so much, Dr. Lindsay. This has been great. We're so happy that you were able to join us today. I think we all learned a lot. So we appreciate your time.
Thank you for your help, and thanks for our boss man help there. Thanks.
Yes. For sure. Well,
y'all have a good day. Y'all have a good day and a good weekend coming up. Thanks.
You too. You too.
Bye-bye.
Yes. All right. And before we jump off, just please make sure you fill out that survey. I believe Juliana put it in the chat again. We really want to get your feedback on our educational series and just try to learn more about how we can potentially improve it. And as well, please make sure that you join us for our last meeting of 2023. So crazy to think that we're already getting so close to the end of the year, but the hyperlinks for the Zoom registration for the meetings are at the bottom of each meeting flyer that goes out on the meeting schedule that's sent out with it. So you can go ahead and register for our November meeting and get it on your calendar now. So hope you all have a great weekend, and we look forward to seeing you all in November.